All right, you guys ready? Do something. I don't know what do you guys do these days? Like peace signs? Do you throw your hands up in the air? I have no idea. You're Adam Johnson, and it is time to think. So for the outline, we're gonna go over who, where, what, when, how. Oh my God. Who, where, what, when, why, and how. And if we have time, we'll go over 10 lessons I learned from my mom. All right, so who am I? I already did this. I'm Dr. Johnson. All right, so we're gonna quickly go through me. Yes, I was cool in high school. I was prom king. Thank you for laughing. I played the guitar for fun. I like petting animals. That's me in South Africa, Peru, and in Australia. For fun, I also like to do kung fu. I also like to dress up. I was stage 4 breast cancer, and the following day my dad wrote her a letter stating God told him that they were going to have a son named Adam. After her chemotherapy, radiation, and surgery, her menstrual cycle actually stopped, but then she found out she was pregnant with me in 1990. One of her doctors recommended that she get an abortion. She said no, and then I was born on June 28th, 1991, and my astrological sign is it's a Cancer. You guys get the story. It's like I'm a superhero or something. Where there is an Air Force base. That's about it. I don't recommend going there. All right. Good crowd here. All right. What do I do? So once again, I am a breast surgical oncologist, and that is a surgeon that primarily treats breast cancer. When did I decide to become a doctor? I decided to become a doctor when I was in high school. You see that beautiful woman, that is my mother. When I was in the 10th grade, she set up my first shadowing experience with the doctor. And then I went home one day and said, hey, Mom, I want to become a surgeon. And she said, one day, you can do surgery on me, and we will see how that ties in later. Why did I decide to become a doctor? All right, so in 1988, my mom's mom died of breast cancer. In 1996, my mom's sister died of breast cancer. In 1997, my mom's brother died of cancer. And then unfortunately in 2001, my mom's cancer came back and she died of complications due to her treatment in 2011. So that is my passion. That's why you can call me the pink superhero. This disease has really affected my family. Earlier in today's talk, I believe Kyla Murphy, the genetic counselor, she talked about genes and things that your family can inherit that cause you to have cancer. So my family did test positive for BRCA1. And then I was actually tested during my fellowship here, and Kyla was my genetic counselor, and thankfully I'm immune to cancer. Once again, superhero. Working hard, being diligent, and then you guys are high school students, right? High school, very cool. High school, once again, I would say even now, if you are interested in becoming a physician, try to shadow a doctor, shadow a surgeon, or whatever, because that initial spark can kind of help carry you forward as you're moving towards your goals. In high school, I would encourage you all to volunteer and hold a leadership position, because at the end of the day, doctors, we are leaders. It is our job to educate our community and to heal our community. All right, college. We're going to talk about how long it took me to get here. I know I look very, very young, but I've been in school for a very, very, very long time. All right, so college for most people is 4 to 5 years. I went to Morehouse College in Atlanta, Georgia. That's also where Martin Luther King graduated from. 100-hour weeks, and it was really important for me to find friends in residency. Your friends, your co-residents become your friends, your family at this point. And once again, if you're having some issues, ask for help. All right, breast surgical oncology fellowship. This was for me 1 year, but for other surgical oncologists, it can be 3 years. And this is just specialized training. This is where I rotated through radiation oncology, medical oncology. I did 6 months of breast surgical oncology, and I worked with some of the other lovely people. I met Terry during my fellowship year. This was probably my favorite year of actual training because it was just breast all the time. And you're really transitioning from being a student and someone in training into being an attending. I see you. Good job. All right, we're almost done, guys. So now I am a breast surgical oncology attending. I literally ran down from clinic to meet with you guys. And so I have clinic on Mondays and Tuesdays. Wednesdays is my typical community service planning day, which I really appreciate. I do love community service. As you guys can see here in the background, I actually was able to put on a 6-week summer program for the Aging Young Scholars. So these are ninth graders learning about breast cancer, learning how to suture. All right, can I do this real quick? All right, these are 10 lessons I learned from my mom. She used to be a teacher. Number 1, never. And then 10, this is Breast Cancer Awareness Month, so I have to end it with the girl stuff. It says, be courageous, be strong, be a warrior, and fight like a girl. Thank you guys, and if you all have any questions, let's go. Yes.
What's your TikTok?
Oh my God. One of my favorite questions for today. My TikTok is it right after phone now? I love that. Oh, and I have a podcast coming out this month for Breast Cancer Awareness Month. This is beautiful. It is Dr. Pink _MD. Okay. Yes, and those are free. Dr. Pink. Wait, so it's like Dr. Dot. That's important. Dr. Dot, like the period. Pink _MD. A typical day for me. So on Mondays and Tuesdays, those are my clinic days. So that's just, I come into office typically around 7:30. Clinic for me typically ends around 4:30, and I'm just seeing patients back to back to back. Oftentimes, when patients come to see me, they already know that they have cancer. Cancer has already been diagnosed. So at that point, I am more so there to talk about the surgical management of their disease.
Was it hard going into a profession after losing so many people in your family? So if it was, how did you deal with that?
That was a very good question. That struck a nerve actually. I'm dealing with that right now. One is therapy. Oftentimes I feel like people in our positions, we want to put on the front. We want to act like everything's okay. We want to say, hey, I don't need help. I don't have any problems. I'm not sad. I'm not depressed. Well, let me tell you something about me. I get sad. I get depressed. And 2 things that I do, I journal a lot, and therapy has helped. I will say there are days that I am sad, reflecting on everyone that I've lost. But then there's those days where I get to tell someone, hey, we get all the cancer, and just kind of seeing that joy in their face, or just seeing the appreciation from family members can kind of carry me over the sadness.